Good afternoon. We are talking to you on Chiricahua Live. Still trying to get us at the right level here. I am sitting in a dental chair, if you notice, and I'm talking to our board-certified pediatric dentist, Dr. Pamela Kaminski. I want to say hi.
Hi, everybody.
So, because this month is National Children's Dental Health Month. And so I wanted to take this opportunity to have our pediatric dentist, Pamela Kaminski, give us some tips on children's dental health. Good reminder that you should get your teeth cleaned. You should bring your children to get your teeth cleaned. How often?
Well, I like to see the kids every 6 months. I just think it's a really good interval because you can catch problems early and, you don't want to wait until, the kid is having a toothache or whatever so that, we can get things early when it doesn't come to that. So, yeah. And every 6 months, I like to see them. Absolutely.
So, every 6 months?
Yeah.
For cleaning and exam?
Yeah, I would do that. I mean, you can get your teeth cleaned every 6 months. That is fine. And then I like to just take a peek at them and see how they're doing, with all the treatment that we've done or things that we haven't even done. We're just trying to make sure that we don't have to do anything that gets, too out of hand. But yeah, I think that's a really good interval.
Great. So we, at Chiricahua, we see a lot of kids,
yes.
Right?
Yes.
We see a lot of kids.
Yeah.
Do we treat all kids? Can anyone come here?
Oh, yeah. Yeah. We start as early as, they say that you shouldn't bring your child any later than 1 year of age. So as soon as this first tooth comes in, around 6 months of age, say, you should be bringing them in so that we can see the kid, see the tooth, talk to the mom talk to mom and dad about, keeping the teeth clean, not putting the child to bed with a bottle, with milk or juice or soda, things like that. So we can at least, start talking to parents about those types of things that will help prevent the cavities. So, things like if the child has to have the bottle, put them to bed with water, and that's harmless. It's completely harmless. So, yeah, and then going over, oral hygiene instructions, too, with the parents, too, because a lot of times they don't really know that they should be in there, cleaning the teeth and stuff, so.
What kind of advice do you give to new parents with, young babies or babies with just a few teeth for oral hygiene?
We say, we take, like, one of our little brushes that actually fits on your finger, and you can brush the teeth, just very easily and very quickly. They'll probably be, crying or whatever, but they'll get used to it after a while. That's the whole idea, to get them used to that. Then you can take maybe a clean washcloth or something and put water on that and just clean the gums or clean the teeth that way. Anything that you can get in there and clean the biofilm off the teeth, that's the best thing to do. And especially before they go to bed, because that way the stuff everything is clean. You don't have that stuff sitting on there all night and just creating cavities and creating problems.
Okay.
So, yeah.
And we have a new treatment at Chiricahua that Dr. Kaminski is the champion of, and she's very excited about. So I wanted you to tell us about this new treatment.
Yes, it is called silver diamine fluoride, and I cannot even sleep at night sometimes thinking about this because for once, we as dentists are finally treating the cavities. We're actually treating them. We're putting this silver diamine fluoride on the teeth. No shots, no drilling. The kids love it. Oh, maybe it doesn't taste that good, but we try to put a layer of the fluoride varnish that tastes like bubble gum on top of that, so that keeps the contact of the silver diamine fluoride in contact with the cavities, and it stalls the progression of the decay. It stops the progression of the decay. So we apply it to the tooth. It only takes a minute to keep that stuff on the area of decay. The only drawback is those areas of decay will turn black. So, if you've got cavities that are in the front of the teeth, on the front of the mouth, some moms and dads don't really like that. Some moms and dads are saying, okay, these are baby teeth, just like we say, they're baby teeth, they're gonna come out. At least you stall the process of the decay until the kid is a little bit older and they can actually handle us maybe putting some little resin crowns or something in there that's a little bit more aesthetic. But it's just so fantastic. We're using it on little kids, to keep them out of, having to be sedated. We don't do sedations here at Chiricahua, but, moms and dads sometimes take the kids elsewhere to be sedated. And that, as we know, can be somewhat, problematic and even dangerous. So we're trying to keep that away from the kids nowadays. We're putting the silver diamine fluoride on there to just stop this progression of the decay. And we're just so excited to be actually treating the cavities rather than just, excavating them out, putting the filling in there, and then the kid bites on a gummy bear. Not that that ever would happen, but, they bite on the gummy bear and pulls the filling out, and now we're back to square one because now we got to put the filling back in and go through all that. Whereas if, you've got the treatment of the cavity, sometimes, yes, you still have to put a little bit of the resin material in there because if you have actual cavitation, which is like the hole in the tooth, the kid keeps packing food in there, and that can be a pain. So, you put a little filling in there, and then you're good to go. And sometimes you don't do anything. You don't do one more thing, and the kid the tooth comes out, and it's got a little black dot on it. Okay, big deal. So,
okay.
Yeah, that's
cool. So silver diamine
fluoride, absolutely.
Fluoride.
SDF. That's what we're talking about.
Okay.
Yes.
So come to Chiricahua. You can get silver diamine fluoride in lieu of other treatments for cavities.
That's right.
For kids. I did want to ask you, what is your number one thing that you wish parents knew? That when they come in and you see kids and you say, oh, I wish every kid did this or every parent did this.
Oh, that is a really good question. I mean, I would have to say maybe not. I have a lot of parents are very anxious when they do come in. And they're afraid of what I'm going to see and tell them. And they're already beating themselves up over, oh my gosh, I didn't do this, or, I didn't do that, or whatever. And I just wish that they could be calm and say, like me, I'm so calm. But, be calm and say, okay, this is where we're at. This is what we got going on. And, we're going to go from this step to that step, and it's going to be okay. So, and just come here and let us help you, is that's all I can say. Yeah.
So if you're here, you're already doing a big step forward in taking care of your child's oral health.
That's right. That's exactly right. That's my thing. Or I always say, thank you for coming. Just thank you for coming here. Now, and they're so grateful because they now learn some stuff, especially with the silver diamine fluoride. Who the heck would have thought that would be even possible? Yeah. And they do tell me that they've been to, this other dentist, that other dentist, and that dentist told them that that's not possible. And so I'm thinking, well, okay, I don't know what they're doing or what they're thinking or what they're researching, but we here at Chiricahua are on it. I mean, we're on the cutting edge because that's what I'm talking about. And silver diamine fluoride, that's cutting edge right there. Yep.
That's great.
Yes, it is.
So do you have anything else you want to add?
I think that's it.
Okay.
Yeah, just bring them in. Bring them in. Let's see
bring
you.
your
Let's
kids in. Brush your teeth. Take care of your teeth. And remember, I've been told this before. Your first 2 sets of teeth are free. After that, you have to pay for them.
Oh, yeah. Oh, no.
And they're very expensive. So take care of your teeth.
And you're going to pay dearly because it's not going to be anything like your natural teeth. Thank you. Oh, my God. Yeah, that's true. That's true. Oh, my gosh. Wow.
So happy National Children's Dental Health Month. And remember to take extra care of your teeth this month. It's a good reminder for us that we say put the mouth back into the body. Make it part of your overall health care.
That's right. That's right. The holistic approach. That's very good. Thank you. That's awesome.
Thank you. Have a good day.
Okay, bye, you guys.